Hello, hello. Hello, everybody. I'm Catalina and Dr. I'm a functional medicine physician. I transitioned from internal medicine to functional medicine 5 years ago. And since then, it's been an amazing journey. And I wanted to inspire other physicians to maybe take a look and see how amazing this functional medicine, integrative medicine area is, because I think it is the future. More and more people are looking for it. And I thought that maybe talking to different physicians that have made this transition and finding out what was at the origin of what was the story of origin and how their journey has been since then would inspire others. So today we have a special guest on the podcast, Dr. Gabriela Pichardo. Welcome, welcome.
Thank you. Thanks for having me. I'm excited to be here on a Friday afternoon.
My pleasure, my pleasure. So I know that you practice, primary care, and you transitioned pretty much kind of when I did too, around COVID time, right? So tell us what made you jump into functional medicine, integrative medicine. What
Sure.
was that trigger?
Yeah, I would say I definitely had more than one specific trigger. I think a lot of us kind of start in this journey trying to kind of look more answers, especially for ourselves. I feel like I've struggled and have my own kind of health journey. So originally, I was working pretty much for corporate healthcare a couple of years back, and I was loving what I was doing, but the whole system, how our insurance-based model is, it wasn't working out for me. I mean, they wanted me to obviously start increasing my amount of patients that I was seeing, and we were like expected to at least minimum being an internist, being at least like 20 patients in a day. And I mean, some of these patients, they come with a lot of conditions that they've been having for years. And being an internist, I tend to see more like older population, so they were having this long list of medications. A lot of them were like, doc, should I keep on this, or what should I do, or I'm having this issue, should I get on a specific diet, what should I do? And I didn't have any answers. And I mean, yeah, my answers back then was, yeah, here, prescribe something. And I would be like, unfortunately, if it was somebody that was suffering with headaches, I was never talking to them about, there are certain things like histamine can trigger your headaches. It could be environmental. There are several factors that I actually do now with my patients. But back then I was like, you know what? Just start taking the pill, get your pain with the pill under control, right? And I'm gonna refer you to the neurologist. And it was like quite literally not even 10 minutes spent with my patients. So because I was just thinking and rushing through to be able to complete my day to move on to the next. Because honestly, that's how a lot of physicians get compensated. The more work, the more quantity of patients you see, the more reimbursement you will get. So there's a lack of focus on quality of care and more on quantity, which is, it wasn't something that was like, really, this is what I have to expect of working in a primary care environment. So I actually started, I got somebody had commented to me about the integrative medicine conference that was happening. It's called the IHM, which is the Academy of Integrative Medicine Health. It always occurs once a year around fall time. And I'm like, you know what? I need some CMEs. I love what they were offering with, what is this about, like guided meditation, nutrition talks. There were also amazing speakers. So I was like, let me go ahead and try this out. And I was just blown away. I'm like, this is the way that I want to practice medicine. And back then I was getting a little bit of burnout. Obviously, I wasn't sleeping. I was making very poor choices, especially with my diet. And it wasn't
As a
until,
physician. So
Yeah,
what can we
right.
expect from patients from,
Exactly.
we don't take care of ourselves?
Oh yeah,
And
totally.
absolutely, right? Yeah.
Yeah,
And
I agree. I did not learn or knew how to properly eat from medical school all the way in residency. I mean, there are some, certain places that they're making some changes on this slowly. But back then, I didn't have that type of exposure. So I was like, I really want to, but I did realize that to try to integrate that model, I do need to have spend time with the patient. So getting to know the patient, getting to know, their spiritual belief, their sleep habits, their dietary habits, like really get a good clinical history. And this is how I've actually have helped a lot of my patients by unmasking a lot of issues. And most of my patients that I see now, they unfortunately have seen like 2, 3 different type of specialists, and they get a little bit overwhelmed because each specialist, which I understand this, they're going to focus on their own area of expertise. Myself as a primary care physician slash more integrated functional, I'm able to see the whole picture, and I'm actually able to sort of like review and take my time, like seeing what the cardiologist told to my patient, the orthopedist told to my patient, and kind of try to come up with a plan for them. So going back to back then when I was doing the conference, that's when I decided to join the fellowship, and I did my training for about 2 years, and I just continue doing and always learning and expanding. I also joined the IFM, which is the Institute of Functional Medicine, and I started to also, within the fellowship that I joined, I was even with other like-minded physicians and people that are a bit, even specialists also, there were in that group, and people from all over the world. So I'm like, I'm not alone. There's other doctors that want to make a difference. Or even, I mean, we were a group of like doctors, nurses, etc. So I really, really love that I had that type of exposure, because I always think back and I'm like, back then, if I didn't do this, where would I be now? So,
Mhm.
but maybe I would have still find my answers and find like, the the true way that I'm practicing now, which is spending the time that I need, that I want with my patients, better servicing my patients, spending the time addressing all the different the different aspect of their lives, right? Especially with their diet, etc. So I feel like this is the way we should practice medicine.
Yeah, yeah. It's interesting how traditional medicine is so fragmented,
Right.
and that's why a lot of things happen actually, because there's no time for traditional, even primary care physicians to put it all together. And plus there are people that don't have a primary care and they keep going to specialists and they think that that's okay, but it's not actually. And I I like how you said you were blown away by
Yeah.
that experience, right? By everything. Like, where was I?
Exactly. It was through eye-opening experience, and I was doing some nature walk and forest bathing, and I was amazed. Like, so many patients, especially now in the kind of world that we live in, we tend to see so many people even struggling with things like high stress and mental health, and we do see it in our field, right? Especially with physician burnout. You're so stressed because you want to keep up with the metrics, get paid, get going, work, and you have such little time, and even having it's not even satisfying, that's at least how I feel. And I know a lot of other docs that actually transition, like yourself, obviously with doing functional, felt the same way. They're either joined because they were disappointed of what the system is currently, or they joined because they had some sort of their own healing journey, and they knew that the way that they got better was by doing this more of the functional medicine work.
Right. Exactly. Exactly. And I think, is that just like on the plane, right? You put the mask on you first and then on your loved ones. So if we figure out how to take care of ourselves, and then we can share with our patients this lifestyle, because that's for everybody. It's not that you have this illness and, no, the healthy lifestyle is the same for everybody. Of course, with the appropriate, changes for different medical problems, but we're trying to fix them, to go to the root cause of those issues, not just be okay with just controlling them with medications.
Yeah, and a big part is, and this is why I feel like when I started doing integrated medicine gives you that good base to also start doing more of that. I mean, kind of also the functional medicine aspect, because they're kind of like intertwined with each other. But I would have to say that it kind of opened my eyes for all the different modalities that are out there, especially like certain things that they might do in Asia or Europe, like, that we not commonly may see here, for example, in the US. So, and we are also practicing evidence-based medicine. I mean, there are certain things that clearly a patient may come to me and say, hey, doc, I saw this new therapy. Do you think this is going to be good for me? So I do take my time and look at the research. So I have a conversation with my patient. I said, hey, listen, there hasn't been that much randomized controlled trials, but the outcomes and based on the study. And I have a conversation with them, and just, especially because I have so many patients that they're like, they try so many things, or they have had so many unwanted side effects from those treatment or medication, that at least we're trying to kind of look outside and kind of in a more, I don't want to say alternative, but like a different modality, right? Or looking a different form of treatment that might help them. So I feel like there's a lot of misconceptions out there about functional medicine and the way that sometimes it might be practiced by others. But the reality is that when I also started doing my training with the functional medicine, especially with the IFM, I felt like I was going back to medical school, because all those pathways and the Krebs cycle and biochem, and I was like, I feel like I was not going to see this ever again, but a lot of this makes sense.
Yeah,
Or how the vitamin D works for you, especially as more like a hormone, and all the changes and all these genes that actually activates, or how much you may need a certain substrate, especially methylated B vitamins, to actually get neurotransmitters working for you. So that way, probably if you have a treatment for depression, it works better for you, because you're giving your body what it needs. So it's almost like you are helping the patient optimizing without, making too many drastic changes for them. I mean, I have had some patients that, and kind of going with that example with the depression, for example, for mental health, that they had a option for getting a secondary, let's say, medication, because they were not controlled. And by me addressing methylfolate, they got better without the need of adding a secondary medication. And then obviously I work on the other aspects with them, right? So, I mean, I like to combine what I've learned in my training as an internist and being board certified internal medicine doc, with also my learning the everything that I've learned through becoming board certified internal medicine, and also learning the functional medicine as well.
Right. Yeah, absolutely. And there, two things there. So first of all, you said you research, you're open to discussing patients' questions and the research that's around it, which is different from in traditional medicine, where first of all, yeah, of course, people don't have time, and they're not
do it. Yeah.
open to looking. They say, stop all your supplements.
Yeah.
No, don't. Hold on a second. Don't do that. Right. That's one thing. And yeah, definitely applying all we learned in medical school.
Right.
Because those things still exist. Enzymes do exist, pathways do exist. So they cannot be just ignored.
Right.
Right. So if you were thinking like, okay, what do you wish you would have known about this sooner?
Oh yeah, I was like, man, my life would have been so different. I wish I would have known. I think since I was even in medical school, but I know I did my medical school back in my home country, Dominican Republic, and it's kind of interesting because the training there, it's very driven, like Western medicine, allopathic medicine. But I did grow up with certain things like my grandmother, or like you might need to do this type of broth and onion and spices, or adding things just because opens up the if you're having like congestion issue, upper like these kind of like home remedies type of things. So I
Yeah.
kind of grew up in that type of environment, which was so common for us and still
Mhm.
is in my culture. But I feel like over the years people have kind of slowly been losing that. Or there would be if you're having a tummy ache, ginger and lemon, things that are like easy accessible, because usually people try to do as much as they can to help themselves out, versus jumping right away to seeing a doctor to get an antibiotic prescribed because I'm having an upper respiratory infection. Like there's so many things that we can try to do before that, or to kind of help your immune system to actually help prevent infections. Like there's so many things that people can do. So that's I grew up with that uh, um, sort of vision, and with my with my culture. But to me, when I started doing more of the integrative medicine and I was learning about the different herbs, etc., I was like, oh, this is why I was probably getting this when I was a kid. So I mean, it's not like made up. It's not made up science. Some people
Yeah.
may take like function like it's something made up. It's not.
No, it's basic. And I think the other thing is that really it should not be the last resort. It should be the
The
first
first
resort,
one, yeah, yeah,
first line, not jump to medication or to tradition. Of course, traditional medicine and acute care, emergency and all that, absolutely, absolutely.
right, right,
But definitely trying natural ways first and figuring out what's happening first before
right.
just putting a band-aid on it. It's definitely the way to go. What do you think has been, if you think about it, like what has been the biggest impact on your life since you transitioned to functional to integrative medicine?
I would have to say in my life, I do have a better work-life balance. Um, I do. I mean, now I'm in an actual like I'm having a little bit of a different type of stress because I recently became more of I'm now a clinic owner, owning my own clinic, a medical director. So with that comes a lot of responsibilities. But in general, I do like my ability of making my own timing and schedule, in the sense that I can actually spend enough time with my patients. Even though if I were probably corporate, you know, you get a lot of benefits and a beautiful salary, but I realized that all that money I didn't get a chance to enjoy. Um, and I was just kind of like struggling with the burnout, right? Because after my day ended, there were the other work, which is completing the notes. I was like staying up, starting work with notes after like 6 7 o'clock, staying up until like 11, just doing notes, right? And also working over the weekend, so not even spending enough time with my family. So now I'm actually able to spend good amount of time with my family, and not spending with just completing charts. And it gets you, like, it sucks the life out of you, quite literally, when you're like in that world, right? It almost like you become like a robot, like you're not doing things like, what am I doing? Is this completing me? Like, is this really what I wanted to do? And then you even start questioning, did I really wanted to become a doctor? Like, what if I should have chosen a different career? Like you start doubting, right? And then when I realized that there's a different way of practicing, I'm like, I'm gonna do this. And that's it, it's been rewarding, truly rewarding.
Yeah, absolutely. I know I've always been in private practice, so that was not new for me. And I kind of always, kind of saw as many patients as I wanted. But absolutely, it came with a financial, downside to it. And so it's I don't think it's right to let a third party determine how much time you need with a patient and the level of complexity of that person's problems, what
Right.
has to be addressed today. So that's not right. So definitely, functional medicine is much better for everybody.
Yeah, yeah, I agree.
For everybody. Is there anything that you used to recommend or do when you were practicing traditional medicine straight that you never recommend now in function as a functional medicine physician?
Um, hmm. That's actually a good question because I'm actually still I'm still practicing primary care in the sense that the way our clinic is set up, I'm still functioning as my patient's primary care with the added, functional medicine, integrated medicine. I would have to say that before we would be when I was like working for corporate, we were putting people on statins right off the bat, left and right. Now I take a step back and I really analyze and I really check their cardiovascular risk factor and I really go over the my approach is more like lower levels if of the dosing if I would have to prescribe, but I do have that conversation with my patients. A lot of my patients also when they have been put on statins and they're some of them may be already kind of a little bit traumatized because let's say they start on a statin like a very high dose and they start having a lot of pain and issues and they didn't realize that statins depletes CoQ10. So now I've been seeing more cardiologists actually using coke, which is kind of great, but back then we were not doing that, so I was just kind of harming more of my patients. And I have had some patients even back then that they were like, but I understand that. But why do I have to be on a statin when my diet is pretty good and my LDL is good? But it was more like, well, because your insurance is asking me because you have the diagnosis of diabetes, even though they were well controlled. And yes, there is a risk factor for these patients, and it's not because of just lowering, it's not just lowering cholesterol, it's more for inflammation. But there were some cases that they were, inflammatory markers were great. They were actually doing great with their diet. We were keeping up with the numbers. So I would make my decision with my patient. Yes, look, we don't need to be jumping on a statin for right now. And then, I would do their, whenever they would come for a follow-up, well, this is what I do now. I always evaluate what is the risk factor for cardiovascular disease. Are they in a lower and a moderate or higher risk type of tier? I think that would be, I think it's not like there's a particular medication that I would definitely, that comes to my mind that I would say that I would never give again whatsoever. It's more like now that I know a little bit more, I can modify, I can try other things. And yes, there's always a time and place. I have had some difficult conversations with patients in the sense that they wanted to do everything completely with supplements, and it comes to a point that, listen, if if you are like my father, my brother, my cousin, I would highly recommend you have to be on this. There's no chance. And I have that conversation with them and people are like, okay, yeah, you're right. So I would have to say that now I have an opportunity to discuss things better with my patients, to actually more do a collaborative collaborate decision making.
Yeah.
It's not like take this and then they're like, why? I don't care, just take it. I'm not in that type. Not that I was like that talking to a patient before, but just to kind of give you an idea. Now it's a okay, let's review the data. Let's see if this actually makes sense. Or have you tried this? Or can we modify this? So I work more with my patients, other than I have also the flexibility to also see them if I'm working with them for something closely, because I'm starting something or trying out something. I can definitely see them within a week, for example, or even the same week, just because I'm managing a smaller practice as well. So I'm not burning myself out with like 2,000, 4,000 patients, which some at one point I think I had in my panel.
Yeah.
So
Yeah.
that doesn't happen now, but some of those patients, even when they wanted to get to see me, they couldn't because I was always so booked. So their appointments, they have to wait like 3 months or 4 months, but now at least I'm able to take care of and help my patients much sooner and not keeping with the waiting period, right?
Absolutely. And you've noticed different attitude of patients now because they feel so much more understood.
Yeah.
And they feel like you really have their interest at heart. And it's like, okay, let's make a decision together because I understand your preferences. I honor them, but this is what needs to be done. And, but in the end, it's your choice. And people that are in patients that come to functional medicine practitioners, I believe they're more dedicated, more invested in their health, and they understand that health is wealth, right?
Right.
And they're more committed and to the long way, to not the fast, okay, give me a pill, fix me right now. No, let me take the road less traveled and let me get to the end result, which is going to be wonderful, but it's going to require some effort on my part too, not just
Right. And even I mean, and like I said before, that there's always a time and place for medication, so I don't disregard that, of course. But I have seen some patients that, because they were placed on medications, they ended up having secondary side effects or some sort of a poor outcome that they wanted, that they didn't expect. So obviously for depending on what outcome they have, then obviously I kind of look into, like, and just to give you kind of like example that comes to my mind, I did had a case where they didn't realize that my patient, the seizure medication may have contributed to a new onset cardiac arrhythmia. I actually did the digging, and which again, it's a very good neurologist that said that my patient was seeing, but unfortunately, because they did not had enough time, because my patient was telling the neurologist, hey, when I started the medication, then my problems started going. So the neurologist, obviously, maybe being a much more hectic environment and so many patients they need to see, the solution was like, nope, that's never happened when I've seen cases using this medication. So let's go ahead and send you to the cardiologist. So bounce to the cardiologist. So anyways, because my patient wasn't getting too many answers, then she comes back to me, what should I do? And then I looked into it and dig further. And then, yeah, the neurologist, when my patient presented that data, the neurologist was like, oh, okay, right. So it's not that it's a bad, and that's that what I've tend to see, that some patients come to me and saying like, oh, it was not a good doctor, or things like that, when they have made comments about their specialist or something like that. And I said, it's just that our system works against them.
Yeah.
They don't
Yeah.
have enough time because they have so much, they have the knowledge, they have all the in their brain, everything that they've learned, right? And they've specialized and they've keep up, like you have to keep up with your board certification and all that. So that is important, right? But it is that unfortunately the way our system is set up, you don't have time. literally you don't have time. You're just like rushing in. And we were discussing this about earlier. One of my staff was saying like, yeah, sometimes they would like knock on the door when already 3 or 5 minutes have passed, like, so that way alert the doctor like, hey, you have to move on to the next. And I'm like, especially when you're having a serious discussion, with a patient, like you need the time.
Absolutely. Absolutely. It's um, and people feel rushed and they don't feel heard. And
Exactly.
that's not definitely not the right approach. Definitely not. Wow. So if you were writing a letter to yourself 10 years from now, describing your life 10 years from now, what would you write in that letter? How would you describe
Mhm.
your life?
That's kind of interesting. And I would say that I have lived a very fulfilling life, especially making my dreams come true. And then my professional, like I originally, when I was doing working for corporate healthcare, I was like, one day I'm going to go ahead and try to go more in the private sector, or practice primary care the way that I want to practice, finish my integrative. So I made that happen. And then my next step was obviously, becoming a clinic owner and have my own practice, etc. So I would have to say that 10 years from now, I would have probably have achieved, or I have already achieved most of my goals, and at least the things that achieving the way that I wanted to practice medicine. Because for me, that is, I wouldn't change it for anything in the world. And for me, that would be the most fulfilling. And that it took a lot of guts, resilience, strength. And I'm happy that I did it and made it happen, because it's pretty scary when you've been, practicing in a certain way and then jumping into something completely different, where sometimes you might get questioned, not only even from perhaps your family members. Because sometimes in the beginning, my parents were like, what are you doing? Like they didn't understand the concept
What?
of integrated functional.
Yeah,
That doesn't exist over there, but now they're more in tune with those things and aware. But the the they would, not only like my well, I guess going back with the letter, I think I think that's what I would put into my letter, and um kind of like telling myself like, Gabriela, despite of all, you did it, and you made it happen, and you are making a bigger change than if you were have stayed the way that you were practicing. I think honestly, if I wouldn't have gone this route, and just because of the burnout and how kind of happy that I ended up being working in that kind of environment, I probably would have ended up quitting medicine altogether. Which I've known other people that have done that, or
yeah,
they've gone to other things like either coaching, which is great, but like not precisely doing the patient care aspect, probably, right? Which I'm at least glad that I'm able to still fulfill and do that, and be able to see patients and make a difference in their lives, and make them feel better.
absolutely. Beautiful, beautiful. Yeah, definitely. I heard it said success without fulfillment is actually a failure. And I think in for physicians, they have to realize sooner or later exactly what makes them happy,
Right.
because you can definitely make a bigger difference and you can be happier when you practice the way you want to practice, not the way you're told or forced to practice.
To practice. Yeah, yeah. I do like that ability of having your own autonomy versus being dictated, because it's one thing when you're being dictated within the employer, whatever, right? But the insurance model, it's also a different beast, especially I still try to work of getting doing prior auth because I'm still practicing the primary care aspect of it. Because again, there are certain things or medications that my patient truly need. Um, and it's getting ridiculous sometimes how they're actually denying. And there was even recently with one of the stories going viral of a local surgeon, Dr. Potter, who I love and respect. She was making talking about that on her social media and even in the news about like she had to step out in the middle of surgery because talking with insurance because they didn't want it to continue with the type of surgery they did not want her to do. Yeah. So it's getting crazy on that aspect, but I still do the work. I still help my patients like, hey, if they really need to have this medication, I do the due diligence, like, yes, let's get this because you truly need it. But it's always like a fighting battle. Or there are certain things that insurance doesn't think that it was medically necessary, and I have to try to explain to them and showing them, but patient is doing much better. Or especially if you're doing like the repurposed drugs that is out there that are considered sort of like off-label use, like sometimes, for example, T3 is known to be off-label for depression. I had a lot of patients feeling much better when they get on some T3. Obviously, we do a lot of work first, right? We do address first lifestyle changes, diet, etc. And then I look into deeper, okay, what makes sense for you to take right now with what you have going on. So, yeah.
Right, right. So it's digging deep. It's
Right.
digging deep, and it's a lot of research, and it's the behind the scenes, so to speak, activities that get these wonderful results for our patients, and they get to live much healthier and happier, obviously. And I think mentally wise, they do much better when their health is addressed the way they're comfortable with,
Right, right.
and they get to talk to their doctor like, okay, you understand where I'm at, where I'm coming from. So it's not a all or none type of approach.
Exactly. Yeah, it's definitely like I mentioned earlier, collaborative. You are a team with the patient. It's not a paternalistic type of relationship. Like you have to do this because I say so and I know more than you. It's not that concept. Because I mean, there has been some things that I've actually learned from patients in the sense of either they have done their own digging and they're pretty savvy, and then I actually look into it and I review the data with them and like, you know what, this actually could help, or this actually might make sense on your case, or if we try this route, I honestly would say that if you don't get any improvement or any outcome from it, let's then move on to the next, right? So I also try to help them out because I know sometimes, and I think the thing that makes people more scared about doing this type of work with functional medicine is sometimes they think that it could be more expensive or they might have
Mhm.
more of that financial burden. But there are things that, as long as you're a great clinician, you do not have to just spend too much money in terms of like doing too many tests, or too many um, um, like type of functional tests. For example, I have had some patients that I meet them where they are. I do propose and I say, hey, if we actually consider doing this, I might be able to help you out more or find out what might be triggering your gut, for example, um, or triggering your migraines or whatever it might be. And if it's an issue like, doctor, that's not covered by insurance, or my insurance won't cover it, or I cannot pay for it, then I do an actual like, okay, we're going to try to do, as a good clinician, I try to pretty much start them on an empirical trial. Like, this is what I think you should do, which, by the way, I would have to say more than like 50% of my patients that come to me with some sort of gut issue that they've been having for years or they've seen in gastro, when I address their diet and their lifestyle and spend my time, a lot of the issues resolve. Now, there are a few that it's still pretty tricky or persistent, or they might be having some sort of other findings that might triggering it. Then, of course, I would proceed and say, it's time, we should consider doing this. So I'm always talking and making that decision with my patient.
Absolutely. Super, super. But talking about tests, yeah, I love the testing. I love the way we do testing to really find out again
Right.
the cause of things. It's and help them. I do weight management, so I love the nutrigenetic study, telling me exactly what they are sensitive to, and if they're gut, or brain or emotional eaters, or slow metabolism, and exactly what, how their body functions. And it's amazing. They have these aha moments. It's like, wow, really? Oh, that's why X, Y, and Z. So yeah, yeah. So closing words, legacy. What would you tell? Would you encourage your children, to go into functional medicine?
Wow, I don't know if any of them would actually become doctors, but who knows? I still have a preteen and teenager now. I would say, because I do have two, my nephews are actually wanting and coming here for U.S. residency for training, because they are medical doctors. One of them actually recently graduated as a doctor. I would definitely encourage them to look into doing more of the aspect with functional medicine, integrative medicine, because I feel like having that additional tool, despite of what you may end up doing, right? Even if it's a specialist, even if it's a cardiologist. Now we have some cardiologists and rheumatologists that are
Oh yeah.
functional. Yeah.
Oh yeah.
And it's
Oh yeah.
amazing because they really have helped me with some of my difficult cases, because at least they're not, they're trying to look more beyond. And sometimes, unfortunately, I do reach with certain specialists like, I don't want to look into it, or they're not willing to discuss it further just because they have had this perception from whatever other bad experience that may happen. Because I'm staying around the same, like, functional, but also within my physician community. And there has been some horror stories, or of some harm that's been done, but it's because it wasn't done the proper way, or they had some sort of that, the sufficient knowledge, right? Or even as a physician. So I would have to say that if you can have a chance to do functional integrative, go for it. Your mind would be blown away like it did for me. You will you would not regret, because I feel like a lot of things are missing, especially with the what how our current model is, especially with the lifestyle aspect, the diet, nutrition, even the connection, the spiritual aspect for the patient, right? So I think that I would highly recommend anyone that, even they had a little thought about it, or like maybe not, go for it.
Super. So for patients that may want to reach out, where can they find you?
So I'm actually, our practice is called Resilient Health Austin, and we are a concierge medicine type of practice, pretty much doing the primary care, functional medicine. We've been doing as well as genomics consults as well, because our clinic has been a flagship for doing medical genomics for a couple of years now. So I and again, I the our website would be www.resilienthealthaustin.com. We have all our information there, and also if there's any particular interest in reaching out and finding out more about us.
Sounds good. Austin, Texas.
Yes.
Excellent. Thank you so much for
Thank
being
you
our
for
guest
having
today.
me. I appreciate. Thank you so much.
Absolutely my pleasure, and we'll keep in touch.
We'll keep in touch.